Let's talk about cancer. It's really a war that's fought inside our own bodies. And in that war, the medications are our weapons, our strategies, our battle plans. So today, we're going to break down those plans, the different ways these drugs fight this incredibly complex disease.
And that, right there, is the million-dollar question, isn't it? See, cancer isn't some germ or virus that invades from the outside. Nope, it's our own cells that have just gone rogue. And that makes treating it this incredibly high-stakes balancing act. How do you take out the bad guys without causing a whole lot of friendly fire? So, just to make sure we're all on the same page, let's get down to the absolute core of the problem. Your normal, healthy cells, they have an off switch. They know when to stop growing. Cancer cells, they threw that switch out the window. They just divide and divide, totally out of control. Every single medication we're about to talk about is designed to throw a wrench into that chaotic process one way or another. All right, so here's our game plan for today. We'll kick things off with a quick look at how these cells rebel in the first place. Then we're going to dive into our main battle plans. Strategy 1 is a full frontal assault, damaging the DNA. Strategy 2 is more like sabotage, stopping division. Then we'll get a little more tactical, looking at how we can starve tumors, and finally, how we can aid the body's own defenses. And we'll wrap it all up by talking about the great challenge of balancing the fight. Okay, let's jump into our first strategy. This one is all about brute force. We're going right for the cancer cell's command center. Its blueprints, the DNA. These drugs are designed to go in there and just shred those plans, making it absolutely impossible for the cell to copy itself. You know, these drugs are kind of like chemical welders. They get into the DNA and create these links, these bonds, that essentially lock the DNA strands together. Imagine trying to unzip a zipper, but someone's welded it shut right in the middle. The DNA can't unwind to be copied, and boom, the cell's entire replication factory grinds to a halt. Let's get specific with a drug called Doxorubicin. This one's a powerhouse. It uses a two-pronged attack. First, it literally wedges itself right into the DNA ladder, jamming up the works. Second, it shuts down an enzyme that the cell needs to untangle its DNA to make copies. It's incredibly effective. But, and this is a big but, look at that key side effect: cardiotoxicity, damage to the heart. This drug is so potent that it can harm heart muscle, so much so that there's a lifetime maximum dose a person can ever receive. And this really gets to the heart of the problem. These DNA-damaging drugs, they're powerful, but they are not picky. They attack any cell that divides quickly. And that's why you see this whole cascade of side effects. Our kidneys, the delicate cells in our ears, our nerve endings, and especially our bone marrow, which is basically a blood cell factory. They all get caught in the crossfire. And that's why monitoring things like kidney function, hearing, and blood counts is just absolutely non-negotiable.
And check this out. This is a real piece of patient education for Doxorubicin. Can you imagine? You're getting this incredibly powerful chemo, and then you see that. It would be terrifying if no one warned you. But it's actually a totally harmless, expected side effect from the drug's bright red color. It's a perfect little example of how important clear, simple communication is when you're going through something this intense.
Okay, on to our second strategy. Now, this approach is a bit more sneaky. Instead of just blowing up the blueprints, these drugs are all about sabotage. They get inside the cell and just freeze its internal assembly line, stopping it right in the middle of trying to divide. Let's follow a drug called Vincristine on its mission. So when a cell gets ready to split into two, it has to build this tiny internal skeleton to pull itself apart. Vincristine slips inside the cancer cell, finds the building blocks for that skeleton, and basically prevents them from assembling. Without that skeleton, the cell gets stuck. It's frozen mid-division, unable to multiply. Pretty clever, right? But that clever mechanism comes with some really unique risks. It turns out those same building blocks are crucial for our nerve cells. So Vincristine is famous for causing nerve damage, that numbness and tingling we call peripheral neuropathy. But the most important thing on this slide, and I cannot stress this enough, is that last point. It is one of the most serious warnings in all of medicine. Vincristine must only be given through an IV. If it is ever accidentally injected into the spinal fluid, it is always tragically fatal. There is zero room for error, period.
All right, let's shift gears to a much more targeted strategy. You see, some cancers are basically addicts. They depend on a specific fuel to grow, like a hormone. So this next class of drugs works by figuring out what that fuel is
and cutting off the supply line. We're essentially going to starve the tumor.
A perfect example of this is tamoxifen. It's used for breast cancers that are fueled by estrogen. Think of these cancer cells as having little docking stations on their surface, just waiting for estrogen. When estrogen locks in, it's the green light for the cell to grow. Tamoxifen is designed to look just enough like estrogen to fit into that docking station and block it. So when the real estrogen comes along, there's nowhere for it to park. The cancer cell never gets its growth signal.
But, when you start messing with the body's hormonal system, there are going to be some ripple effects. Blocking estrogen can trigger menopause-like symptoms, like hot flashes. And here's a tricky one. While it blocks estrogen in the breast, it can actually stimulate it a little bit in the uterus, which increases the risk for endometrial cancer. And most critically, it raises the risk of dangerous blood clots. So any leg pain or shortness of breath is a red flag that needs to be reported immediately. So far, pretty much everything we've talked about has been a direct attack on the cancer. But this next strategy is completely different. These medications don't fight the tumor at all. Instead, they're like the support crew. They either help the patient's body withstand the chemo, or they actually rally the body's own immune system to get in the fight.
Remember how we said chemo wrecks the bone marrow? Well, that's where these guys come in. Think of them as coaches for your blood cells. You've got Filgrastim on one side, which tells the bone marrow, hey, we need more white blood cells, stat, to help fight off infections. And then you've got Epoetin alpha on the other side, which says, okay team, we need more red blood cells to fight that crushing anemia and fatigue that comes with chemo.
And then there's this, which is just a game changer: immunotherapy. Instead of the drug being the weapon, the drug empowers your own immune system to be the weapon. A drug like Interferon basically acts like a signal flare. It helps your immune cells finally recognize cancer cells that have been hiding in plain sight. It's not about bringing in mercenaries, it's about training your own internal army to be smarter and deadlier.
Now, even these helper drugs have their own things to watch for. When you kick the bone marrow into high gear with Filgrastim, it can cause some serious bone pain as the marrow literally expands. Pushing red blood cell production too hard with Epoetin alpha can actually thicken the blood, which raises blood pressure and carries a black box warning for clots if hemoglobin levels get too high. And firing up the immune system with Interferon, that often feels like a really bad case of the flu and carries its own black box warning for causing severe depression.
So, we've looked at brute force DNA damage, sneaky sabotage, targeted starvation, and even calling in the body's own troops. After all of that, what's the one single theme that ties everything together? Well, it all comes down to a really, really delicate balancing act.
And this right here explains almost every side effect of chemotherapy. Ever wonder why chemo makes your hair fall out or causes mouth sores and nausea? Well, what do cancer cells have in common with hair follicles, the lining of your gut, and your bone marrow? They all divide really, really fast. And the drugs, especially the older ones, just aren't smart enough to always tell the difference. The entire art of cancer treatment is figuring out how to inflict maximum damage on the tumor while causing the minimum amount of collateral damage to the patient.
Which brings us to our final big picture question. We started with these broad-spectrum drugs that were like carpet bombs, and now we have medications that can target a single tiny receptor on a single type of cell. As our battle plans get smarter, more sophisticated, and more targeted every single year, you have to wonder, are we heading toward a future where we can actually win this war with zero collateral damage? Could we one day eliminate cancer without making the patient sick? That is the ultimate goal, the holy grail in this ongoing fight.